And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by members of my cabinet, Dr. LaQuandra Nesbitt, Faith Gibson Hubbard, who is the executive director of Thrive by Five, Chris Rodriguez, and Unique Morris Hughes, who is the director of the Department of Employment Services. This morning, we have several updates. We're going to start with the district's response to COVID-19, followed by more general updates and information on next week's Maternal and Infant Health Summit. This morning, we announced 25 new cases of COVID-19 in D.C., and sadly, 4 Washingtonians who lost their lives to the virus. We continue to follow metrics associated with our experience with COVID-19, and you can continue to see that there is community spread of the virus, as well as more information on our testing capacity, our healthcare system capacity, contact tracing, and finally, the percent of positive cases that are related to quarantined cases. And Dr. Nesbitt will say more about that as we continue. Yesterday, we also released an updated list, as is our practice every 2 weeks, of quarantine areas where we advise DC residents who travel there for non-essential activities to quarantine upon their return. Montana and Ohio were added, and Alaska and Arizona were removed from the previous update. We continue to remind residents as well about the availability of COVID testing. And we want everyone, if they feel sick or believe they were exposed to COVID-19, to call their doctor or health care provider. Our Department of Employment Services, at my direction, has required all insurers to provide a weekly COVID test for those people in high-risk groups. Do I have that definition correct, Dr. Nesbitt? So that is available through your own doctor or healthcare provider. You, of course, if you're unable to schedule that testing, to go to a public site, and you can find out where all the public sites are at coronavirus.dc.gov/testing. Last week, we also announced a partnership that the Department of Health, or DC Health, I should say, engineered with Google. And so last week, Apple and Google announced the Exposure Notification Express software that will assist with contact tracing in D.C., Maryland, and Virginia, among other jurisdictions. And I know that residents will be curious to learn more, and they can expect to get more information about how this software will work towards the end of September. Yesterday evening, we also got word that the district's application to participate in the Lost Wages Assistance Program has been accepted. This is another name for the unemployment assistance that the federal government had offered through the CARES Act, except it is not an additional $600, it is an additional $300. This lost wages assistance is also being provided through funds from FEMA. And Dr. Rodriguez and Dr. Morris Hughes can say more about that as the discussion continues. The funds will allow the district to offer an additional benefit of $300 per week to eligible recipients, and payments will be retroactive to August 1st. And we expect that recipients will begin receiving those payments in the beginning of October. We still, however, urge our federal partners to restore the $600 per week unemployment benefit as we continue to combat the effects of the coronavirus. Yesterday, we also announced that we would be providing free internet access for up to 25,000 disconnected families who are in DC public schools or DC public charter schools. And we will directly pay for access for DC families who qualify. You can get more information by going to techtogetherdc.com and finding out more. Parents and guardians with questions can also reach out directly to their child's school. We also have an update on devices distributed through GCPS, and that is, as of yesterday, more than 23,000 devices have been distributed, and we know that that number will continue to increase. We continue calling on families who have not yet enrolled their children in school to do so. Enroll your child. We need every student to be engaged during the first term so that as soon as we are able for in-person learning, we can transition right back into in-person learning. Additionally, families who need tech support can continue to visit backtoschool.dc.gov or call 202-442-5885. We're also reminding our families how important it is to make sure your child is up to date on vaccines. And that includes the flu vaccine, and we are recommending that everyone get it as soon as possible, your children, yourself, and everyone else. And all children over the age of 6 months should be vaccinated for the flu. The CDC also provides a schedule of vaccines at cdc.gov/vaccines, or go to the vaccinefinder.org. And now I want to share some more information about next week's National Maternal and Infant Health Summit. This is the third year that I'm hosting this summit. This year it will be totally virtual, and we expect to have a very productive conversation and have useful resources for moms, dads, and all who attend. So join us for the fully virtual National Maternal and Infant Health Summit. We have commitments for a number of national leaders to join us in this discussion and to join our DC Health and Thrive by 5 and Aussie and all in DC government who have been very active in changing the conversation, changing our focus on resources and how we best serve moms and families in DC. We will be joined by Dr. Anthony Fauci, Congresswoman Robin Kelly, Dr. Aletha Maybanks, who is the Chief Health Equity Officer from the American Medical Association, and the sessions will be moderated by Aaron Haynes, who is Editor-at-Large for the 19th. For the next 3 days, attendees can participate in at least a dozen breakout sessions, and you can learn more and RSVP at dcmaternalhealth.com. So I encourage people to visit the site and register for this year's summit. We see, of course, the dire disparities in health outcomes across a host of issues, and we're very focused in DC on leading the conversation nationwide about changing the trajectory for moms and infants in our country. So with that, we'll pause and take your questions.
Guys, question?
Yes, sir.
So I was last in, I'll ask the first question. Mayor, this is an economic development question. You go around the district right now and you see a lot of space, commercial space that's for lease. What's your perception about what's going on with the commercial office space situation, not only in the district, but in major cities across the country? And a lot of these businesses are seriously considering not going back into full office space, and that does have a domino effect economically on smaller businesses if that were to happen. Is there a plan?
Well, certainly, I think everyone is focused on one thing: how we reopen and reopen safely. And we know in the district, part of doing that is allowing kids to get back to normal, families to get back to normal, and people to get back to work. So that is a lot of what we're focused on. But I think a larger part of your question involves, are people changing the way they work? Are businesses changing the way they work? And then I think that is the discussion is early in the making. I expect that some companies are going to do some things differently, but I think at the end of the day, people will find that working together, the energy around working together and being in cities and surrounded by culture and art and entertainment and green space is something that companies are going to continue to invest in. Yes.
Just follow, does that mean that the district will have to be aggressive in its competition with others that are going to try to lure those, either through, tax credits or some other way?
The district is always competitive and always aggressive about investing in our economy. And we have spent, certainly in my administration and in those of my predecessors, diversifying the district's economy. So not only do we have a federal workforce, but we have a growing creative workforce. We have a growing tech workforce. And we have a growing restaurant and art scene in the city. And so doing all of those things has made our economy more diverse and more resilient. So we actually think in the competition, if you will, we're kind of, all of our peer cities and jurisdictions are in a similar space. And we think that the resilience of our economy will actually allow us to bounce back quicker.
Thank you.
Yes.
Mayor, several of the large charter school networks have kids back in the classrooms in small groups, and I wondered, first of all, whether you think that is going safely, and second, whether that is something that DCPS could do if charter schools are able to do it.
So your question was, I'm going to repeat it correctly. Say it again, please.
Yes, so several of the largest charter networks like Friendship and KIP have students back in classrooms in person in small groups. And I wanted to know if you think that that's going safely, and if it is, whether it's something that DCPS could also consider doing.
So the question was, there are some large charter schools, or maybe small ones too, I'm not sure yet, have kids back in person in some small group learning, and do I think DCPS can do that? The answer is yes. I think DCPS can do it, and I think DCPS should do it. And it is, do I have an assessment of how it's gone yet? Not yet. I have asked the Deputy Mayor for Education to kind of survey the schools, both public charter schools and independent schools, to get some best practices and some experiences. I don't think we have any health data. I'll turn to Dr. Nesbitt to suggest that we have any problem with those small groups. And let me emphasize that I think that may have been your reporting. I read earlier, I'm not sure, I think it was in the Post, that was saying some groups are groups of 2 or 3 or 5. But so I don't want to suggest that we have whole classrooms or whole grades or thousands of kids and going back to a school. That I think that the approaches have been very different. Let me be clear that we believe that in-person learning is preferred to virtual learning, but we also know that we have to do it in a safe way. The decisions that DCPS makes are not for 1 or 2 schools or 5 schools. They have to make a decision for the entire system. So that's what's different than what an independent school might do, or a small group of public charter schools. So we think that we can learn from some of their experiences, but DCPS will have to make decisions that affect several, I think we're like 60 buildings, 50,000 kids, and over 4,000 employees. So I think that there are some best practices we seek to learn from.
Thank you.
Yes.
If I could, well, could I just follow up on that first?
Sure.
Your first answer to that was yes, DCPS can do it and should do it. When should they do it by? Do you have an anticipation of when you would like to see, even if it's just small?
Well, the chancellor is working on those things now, so that I think they have in place a set of guidelines for having people in the school buildings, whether it's a teacher who wants to use his or her own classroom for virtual learning, whether it's small groups. So those things are in the works, and I would anticipate there to be some, not a mass rollout of those opportunities, but approval of those opportunities where they make sense.
So do you know when that approval might come?
I'm not sure, but I would expect it would be in September.
Okay, and then if I could ask for Dr. Nesbitt on today's briefing, we've been seeing over the past week or few weeks, a low number of positive cases and days without deaths, which I think anecdotally a lot of people are taking as good news and, maybe reason to have a positive outlook. But then, we don't seem any closer to phase 3, and you point here on this chart to the red lines of sustained community spread and the percentage of positive cases from quarantined people. So I'm wondering if you could kind of square that circle, put those two different metrics in perspective for us.
Sure, Mark, and this is a conversation we have quite often at the Department of Health and the Health and Medical Branch in the Emergency Operations Center, where both Director Rodriguez and I have the responsibility for managing an august team of experts on both public health and emergency response. We've opted to provide here publicly a set of metrics that we believe to have been the best metrics to help provide a snapshot of what we see from an epi perspective or epidemiological perspective. They are not the only metrics that we look at to really be able to see community spread and understand what's happening from a community spread perspective. So when we are very focused on how many of our cases are connected to each other, that is critically important for us from the perspective of being able to understand the extent of community spread in the community. So that's why I'm always very cautious about getting people to only focus on the number of cases that we are reporting on a day-to-day basis, but also the qualitative nature of the pandemic impact in the district. That being said, I don't want to paint a doom and gloom picture on a daily basis and to not suggest to the community that it is, in some respects, reassuring when we are seeing fewer cases being reported on a daily basis, a lower test positivity rate in the face of still having a high number of individuals, nearly 25,000 tests being done on a weekly basis. So those types of data elements are still reassuring, but it's that composite picture of data metrics that we still need to look at, and we want to see improvement in some areas. So I think we may be at a place where we may need to revisit some of the metrics that are being publicly reported to help people follow along a little bit better with some of our decision making. And so part of my responsibility as the health director is to help people understand what are the best things to look at from a surveillance perspective, which is the data that's used to help people understand who gets infected, who gets the disease, where the disease is occurring. Those are the surveillance things. And then the data that's used to manage, which is what are the things that helps to drive our interventions, what are we gonna do about it, and what helps to drive our policy. So we may need to put some different metrics in front of folks to help you follow along a little bit better.
So are we doing better, worse, about the same?
Well, I think if you look at, if you go to the dashboard that has far more metrics than what we put on this screen when we come before you for a press conference, and the dashboard has always been far more comprehensive, which is why we always encourage you through each one of our presentations with the coronavirus.dc.gov and why that dashboard has been there. It's always been more comprehensive. It has maps. It always has had trend data there. You can see that we've had our peak back in April in terms of the number of cases that we were having on a daily basis, and that number of cases being presented in a host of ways for you to be able to deduce that we are definitely in a better situation. It's difficult to say better when you still have people losing their lives, when you still have people who are being infected with the virus. That doesn't necessarily mean that we are in a position to have the same level of pre-COVID activities we were having in the district when we come to talking about social interactions, releasing reducing or rolling back non-pharmaceutical interventions. Those are two totally different things.
Thank you.
Yes, sir, James.
I have a question for you, Muriel Bowser, and a side question for you, Dr. Nesbitt, off topic. As you know, Initiative 81 will be on the ballot on November the 3rd, and this is the initiative basically authorizing the district to decriminalize plant-based medicines, such as magic mushrooms, that sort of thing. Mayor Bowser, have you expressed your thoughts on this? And Dr. Nesbitt, I know you don't deal with the political side, but in terms of being a doctor, what are your thoughts about this?
I'm going to turn to Dr. Nesbitt first.
Okay.
I'll start. To be honest with you, James, I haven't given it that much thought, other than to say this. I understand that the impetus for this initiative is outside of the district, not inside of the district. It's not my sense that this is a burning issue for DC residents.
So I will say this. I think that it is very challenging as a licensed medical professional to take positions on things that have not been broadly studied and encourage people to use them, not fully appreciating the health effects and health consequences. When we think about some of the other therapies and therapeutic interventions that have been advanced in communities, to later understand that there are some consequences that are adverse to people in certain age groups, that have long-term consequences that people do not fully appreciate and understand when certain other health benefits are promoted as being better than medications that have been studied, that we know both the pros and cons of. I find it very difficult to be able to advocate for them. People talk about things, and I say this to family members all the time, people talk about things being plant-based as if that makes them automatically healthy. Opioids come from the earth, and they're highly addictive substances. Tobacco grows from the earth. It is plant-based. So you have to be very cautious in using terms like plant-based as meaning that it is without addictive and abuse potential, and meaning that it is better than medications that people advertise as being from laboratories, et cetera. So I just use those as cautions for people who talk about plant-based medications as if they have no ability to be toxic to your system or that they don't have any abuse potential at all.
Okay, thank you. Let me, before I take any more questions, ask Dr. Faith Gibson-Hubbard if she wants to add anything about this year's Maternal and Infant Health Summit.
Thank you, Mayor Bowser. This year's National Maternal and Infant Health Summit will be fully virtual, and I thank you, Mayor, for your support in making that happen. We are very excited to be able to connect with people outside of the walls of the convention center and even beyond the boundaries of the District of Columbia. This is a crisis that is not unique to the District of Columbia, and while we have done really great work under the leadership of Dr. Nesbitt at DC Health and also through many of the other agencies that work in this space with young children and their families, we know that there are a lot more conversations to be had. And so this year, in this virtual space, not only are we still able to really highlight what's happening on the national level and also the work that's happening here in the District of Columbia, but we are also able to have a series of breakout sessions that will take place in the days to follow the initial kickoff. And we're excited to say that these sessions are community-led. So while there are some agencies doing sessions such as DC Health and also the Department of Behavioral Health, there are also lay people who are also doing presentations who are birthing doulas in the district and also other organizations. And we have a real youth voice this year as well. As we know, there are young parents who are living here in the District of Columbia, and their needs and their voice also need to be heard. So we are really excited to be able to connect much more broadly this year, and also look forward to the things that we will be doing post-summit as we are working on some programming with the Mayor's Office on Latino Affairs in order to do something fully in Spanish for our Latino community that we know also has many issues that they would like to discuss in their own language. So we're really excited about how we will continue to expand this conversation and continue to work collaboratively to really address the issues that families have been saying that they need, and to really focus on wholeness and well-being.
Okay, very
Thank
good.
you, Mayor.
And Unique, if you want to talk a little bit more about the $300 payment.
Sure. So I want to thank Dr. Rodriguez and you, Mayor Bowser, for helping the district advance an application, a grant application for the Lost Wages Act. What this means for DC residents and DC workers is that an additional $300 per week will be made available to eligible claimants. Now, in order to be an eligible claimant, this means you must receive at least $100 on your weekly benefit, and you will have to have certified that you are unemployed due to a COVID-19 reason. The DC Department of Employment Services looks forward to advancing this additional benefit. My team and myself are prepared, and we look forward to the first week of October when we hope to have this the benefit out. And we have staff that are ready, waiting, and have been trained up to implement this new program. Thank you.
Okay, thank you. Yes, Julie.
Thank you. Dr. Nesbitt, I was wondering if you could explain more to us about this Apple and Google app. What is this? People turn something on their phone and it tells them if they were near someone with coronavirus? How does this work?
Sure, you may be familiar with the exposure notification tool. It's less of an app, it's more of a tool that can be activated on your device. It's completely voluntary. It's already active in the state of Virginia, if you're familiar with COVID-wise. It does not track you. That's the important thing, and we'll be talking about it more later in September, as the mayor mentioned. But what it is, it notifies you if you opt into the program, if you have been exposed to someone who has tested positive for COVID-19. So we're still working through it, and we'll provide more details about it later. But again, it's a program that people volunteer for. If you have an Apple or Android device, then you can activate the tool, the exposure notification tool. We'll provide more details for people exactly how it works in the District of Columbia. Every state has to use the exposure notification tool, which is why it's critically important that we are all doing this in the DC, Maryland, and Virginia area. We know that people move in and out of the area, so we're very excited that all three states are using this tool. because it has to be activated by the state. So we're very excited about this. It will augment some of the work that's already been done here through some of our contact tracing and disease investigation work. It does not replace that work, but it can have the potential to enhance it.
But how does it know if a person's been exposed?
When you activate when you turn on the tool or download the app, depending on what type of device it is, it's all the technology that Apple and Google both uses. It creates this random, very randomized key that is not really stored on your phone, that if someone tests positive and they release the key, so all of these things the user controls, you always control it. Then if someone has a Bluetooth activated device that receives a ping having been exposed to the other individual, then it will send them a notification if they have opted or activated this tool on their phone.
So sorry, I'm just trying to understand this. It's keeping a record of everyone who your phone has pinged their phone at some point, and then if that person who you pinged tests positive, it goes back and says, oh, you were near them.
Only if the key is activated.
If they choose to notify everyone who they were near.
The positive case and the
Only if the key is activated by the person who tests positive, then it will identify all of the keys that they were in contact with during their infectious period, if the tool has been activated by those individuals. So it won't, if you have not activated it, it won't allow you to receive a notification.
Got it. Thank you.
Okay, yes, Mark.
Just one quick follow-up on unemployment insurance. So if you're currently receiving unemployment, do you have to do anything affirmatively to get the additional $300, or will that automatically come to people who have already certified that they're out of work because of the pandemic and are getting over $100?
Yeah, that's correct. So you have to meet those two eligibility criteria, receive the $100, and have had to have certified that you're unemployed due to COVID-19. You don't have to do anything else. You don't have to submit a new unemployment insurance application, and you'll receive your $300 benefit payment retroactive to August 1st.
Can I ask Mayor and Dr. Nesbitt about venues that depend on audiences for their businesses, live music venues, performance venues? We are seeing jurisdictions surrounding us that are ahead of us in phase 3 and whatnot, but that have been at least allowing for outdoor performances. In Virginia, there are indoor performances, but DC still has a ban on any live performances, anything that would really entail an audience. And so, one, when do you see some type of live performances being allowed back in DC? And two, what support can you offer? I believe there's legislation before the council that would offer some financial support to these venues that are really in danger of, we've already seen Twins Jazz on U Street, 33 years in the district, a family-owned business, forced out because of the COVID pandemic. So I know that's a lot of questions there.
Right, and I think you finished in the right place, that COVID has turned our economy upside down. Could you imagine having all school children at home and not at school, and going in the downtown and without seeing it bustling with people? So we are all struggling with how to get back to normal and how to do it safely. And I don't want to sound like a broken record, but part of our ability to provide more relief to our small businesses is to have the federal government do its part with the latest federal relief package that is sitting at the Congress. The House passed it, we need the Senate to pass it, and we need the President to sign it. Local relief, we have already provided more local relief than any jurisdiction in this region with our micro grants, and we are poised to do more, but we need the federal package to come in that would provide more federal dollars that we could get out through our already established micro grants program. So that's critically important. The other thing that we know, Mark, is that even with relaxing of regulations, for example, we allow indoor dining. You can go in a lot of restaurants that are permitted to have indoor dining and you won't see any diners. So we have to make sure that our consumers, our customers are confident in our containing the virus, that they can get back to normal by sending their kids back to school and getting back to work. And only then do I think that our consumer trends will actually change, that people will go back to restaurants, they will go inside venues, and that's not to mention having some confidence in vaccines and all of those things. So that's how I would answer that question. We want to provide those businesses with as much relief as possible. We're devastated that through no fault of their own, and I will repeat this, the president says this a lot, but it's worth saying, these businesses didn't do anything wrong. And what they have been devastated by is this virus. And we're going to do everything that we can to help them get back.
So can I ask specifically about, is there a timeline that where you might see allowing outdoor performances for audiences?
It's certainly under consideration, and I don't have a timeline to provide right now.
Dr. Nesbitt, can you provide any?
I make recommendations to the mayor, Mark.
Okay.
We don't have a timeline to report today. Yes, Tom.
Doctor, the mayor just mentioned confidence in vaccines. And as you know, and I know you don't like to weigh in on politics, but there has been political crossfire this week over vaccines. We got the news that AstraZeneca is pausing its trials to investigate a case in Great Britain. With all of this back and forth over vaccines, what's the best advice you can give to people in the district on how they should process this and process the potential and what a successful vaccine could mean?
Sure. So, I'm actually appreciative that you've asked this question. Because when we talk a lot about getting to phase 4 and what people recall from pre-COVID life, and we have talked about it being, better than normal from an equity perspective here in the District of Columbia, it really is going to require that we have some degree of immunity, either from natural immunity, which we don't know much about now, or from having great uptake of a safe and effective vaccine. So we need our public, residents in the District of Columbia, residents across the U.S., and quite frankly, residents across the globe, to have great confidence in the vaccine and the safety and efficacy of the vaccine. The recent information that we have about the trial with AstraZeneca is not an abnormal occurrence with clinical trials. That's the purpose of clinical trials, is to see what happens when people are inoculated with a vaccine, to see if adverse events occur, to see if people have side effects, or to see if they have reactions. Of course, we don't want people to have adverse reactions, and pharmaceutical companies, people who conduct vaccine research, they do the responsible thing. They stop the trial, they see what caused the reaction or the side effect, they probe further, and many of them, if not all of them, may stop further development of the vaccine to either reconstruct the vaccine and its components to make the vaccine even safer. And that's the purpose of determining safety and efficacy. You'll also note that prior to that occurrence, not only AstraZeneca, but all of the companies who are developing vaccines signed a pledge that they would not put a vaccine on the market that was not both safe and effective. And it's critically important that members of the public understand these things so that they are not mired down with any noise and having any concerns that a vaccine for SARS-CoV-2, the virus that causes COVID-19, is going to be available to the public if it is not safe and effective. And clinicians, public health officials, we are not going to support, distribute, endorse a vaccine that is not safe and effective. Because the only way we get our communities back to its pre-COVID state, into whether we're calling it phase 3, phase 4, phase 5, whatever it is, we've all got a lot of different numbers of our phases in various jurisdictions, is if we have high rates of immunity. And that only happens if our communities have confidence in vaccines. So I wouldn't encourage people to be alarmed by what happened in that trial. I would encourage more people of color to be participating in these clinical trials. I would encourage more people who are seniors, more people who have chronic health conditions, all of the types of folks who need to participate in the clinical trials for us to really know if it's going to be effective in our populations, to participate in these clinical trials so we get the best data on effectiveness, to really step forward and do so. So that's what I want to put on the record today about vaccines and having confidence, and not making this, as you would say, about the politics of vaccines.
Dr. Nesbitt, can we get some more, we'll put on our coronavirus website how people can participate in trials. I've just seen in my social media network some people that I know from various communities who are participating, and that's so important. So frequently, a lot of the drugs and research that is done around what's the average person, the white male of a certain age?
Yeah, white male in his 50s.
A white male in his 50s. Now, you're not, no, nothing wrong with that, except if you're not a white male in your 50s, you kind of want to know the drug works for you too, and so that is important. And I just want to second everything that Dr. Nesbitt said about vaccines, and I was heartened to see the drug companies band together in that way to give confidence to the public that they are that they're following the science and that they will only release something that is shown to be safe and effective. So that's important. But we know that a vaccine that is available right now that is safe and effective, and that's for the flu. So everybody go out and get your flu shots because that is also going to help us protect ourselves. All right, Mark.
Can I ask about the flu shots? And in a normal year, a lot of us would get our flu shots through our employer at work, and a lot of us would get it free at the pharmacy because we have health insurance. But a lot of us aren't going into the office anymore, and so companies aren't providing the flu shots in the workplace like they typically would, just because it's not possible to do that. And with so many people out of work and uninsured in some cases, they can't get free flu shots. So I'm wondering what, if anything, the DC government is doing to make flu shots available to those people who are kind of caught in that gap, that they don't have insurance, they don't have an employer who's providing them for free. How do those people get flu shots?
Let me ask Dr. Nesbitt to address that.
Sure. So we've been fortunate, even with some of the change in our economic indicators, that we still have a relatively healthy insurance rate in the District of Columbia. So this gives us an opportunity to remind people that they can still access insurance through the Health Benefit Exchange, DC Health Link. So we want to make sure people are doing that, even if they've had a change in their employment status. To be more specific with your question, we are working to offer flu clinics or flu shot clinics in the District of Columbia to people at a more enhanced and highly visible way than we have in the past. As you've mentioned, many employers would offer, bring people on site, bring some of the pharmacies on site, clinical staff from pharmacies on site to provide flu shots to their employees. And because so many people are working remotely now, they are available to do work differently. And so we'll be partnering with them, hopefully beginning as early in the next week or two, to co-host some of those flu clinics with our public COVID testing sites. So you'll get more information about that coming up soon. We'll also be working with the Department of Aging and Community Living to continue to host senior-focused sites and locations as well, because we want to reduce the amount of wait time that seniors, those who are at highest risk for COVID-19 infection, to have to mingle and mixed with other members of the general public. We are still going to practice social distancing at these senior-focused sites. So they won't be the same magnitude as some of the health and wellness fairs that seniors were used to in the past, where they would go and do a lot of other health and wellness activities and get their flu shot. So that's how we're focused on being able to still get really good uptake of the flu vaccine in the district this fall.
And when you have those clinics, are those open to just DC residents?
We're focusing on DC residents, but I'm sure as you have experienced, or people who've come to our sites have experienced, we don't, card folks who come to our resources, but we have to be judicious with the resources that we have. Yes, last question.
Okay. Can I just ask for an update on elections and how confident you're feeling in the Board of Elections' ability to administer this strange election and get information out to voters and ballots out?
Well, we are with the council, getting check-ins with the Board of Elections. I have directed actually part of our EOC operation to support logistics that the board has requested of us. That includes help with the distribution of the voter boxes. We have also offered to detail DC government employees to help with staffing, and we're in the process of identifying those employees and making those employees available. We do have a sticking point with the Board of Elections that we will continue to push them on, and that is making more precincts available. And it is my view that every precinct should be open. And so we will continue, if they need more assistance with finding locations or supporting the locations that they've taken off the list, then that's important to do. And let me just say a little bit more about that. We know that kind of a transformation to a mail-in voting system or to early voting happens over many cycles of voting. It doesn't happen overnight. And so it is important to make sure that residents are fully informed of their options, but we also have to be prepared if they say, no, thank you. I don't want option A or B. I want to go to my voting precinct. And waiting in line for 3 hours is no way to conduct an election in the nation's capital. So that will continue to be my recommendation to the council, which I recommended when they considered a piece of emergency legislation, I think in the early summer, I should say. And that will continue to be my recommendation to the board. We, as I've said before, we have an independent board of elections in the district. The mayor, the secretary of the district doesn't run elections, as happens in some places, but the board runs the election.
Thank you.
Off topic? I guess we are on off topic. I've been, and I know you've said in the past that you don't want to go down the Dave Statter rabbit hole, to use your words, but I've reached out to OUC and I've asked them for CAD reports and 911 tapes for some of the instances that Mr. Statter has highlighted in his research. And I was actually told that Dr. Mitchell would be here today to answer questions about this. But I'm wondering, will you direct the OUC to release the CAD reports, release the 911?
No, I will not.
Why not? Because that would just be in the interest of transparency to let the public know why there were delays on these calls.
What calls are you referring to?
Well, I've sent a list of calls to...
Okay, let me take a look at your list. I'll take a look at your list.
Part of the issue is also the reporting. It's not so much whether it was the call taker's fault or the caller's fault that someone might be sent to the wrong address, but that Director Holmes has repeatedly, apparently, underreported the number of wrong addresses given out. And I'm wondering if you see that as a possible problem.
I haven't seen anything to suggest that, Mark, but it's a valid question that we shouldn't have any problem finding out. And if the only source is Mr. Statter, and I haven't heard or seen that anyplace else.
if I could ask on a second question, the rest of the protesters, you at one of the last press conferences, you released a letter from the U.S. Attorney's Office backtracking on his previous letter complaining about no probable cause for the arrest. And now what we're seeing are two things, is that some of those people who were arrested in the kettling in Adams Morgan when 40-some people were arrested and then no paper, have now gotten notice that they are in fact being charged with misdemeanor rioting. And after being arrested, held overnight, released without being charged, then there was the back and forth between you and the USAO, and now they're being notified that in fact they are being charged. I'm wondering if you can just weigh in on that. The lawyers for these people are complaining that this is highly unusual to have this happen, and they feel like they're kind of being caught in something that is more than just misdemeanor rioting.
I don't know what that means.
Well, I'm just wondering, do you have any thoughts on why these people are now being charged after being arrested?
Well, our view is that they should have been charged. They should have been charged at the time. That's our view, and that view hasn't changed.
And then, can you weigh in at all on all of those people who were arrested and not charged, had their phones confiscated, and those phones have not been returned? Do you know, do the police have those phones? Have search warrants been executed on those phones? Again, there's a suspicion from their attorneys that part of the motivation for rounding up all of these protesters was to gain intelligence from their electronic devices. And all of those devices were confiscated and again, have yet to have been returned to those people, even people who had the charges dropped.
I don't know. I don't know the answer to that.
Does that seem something that raises concern for you?
I don't know how soon, when a crime is being investigated, the evidence in that investigation is turned over. So that would be the question I would have for MPD. How soon can you complete what you need to return people's property?
Thank you.
Thanks, everyone.
Thank you.